Get myself organized here. Okay, can we please start with roll call? Oh.
Councillor Mackey.
Present.
Councillor Gamble.
Present.
Councillor Burley.
Present.
Councillor Carlton.
Present.
Councillor McQueen.
Present.
Councillor Desai.
Present.
Councillor Patterson.
Present.
Warden Hicks.
Here.
Councillor Kentner.
Present.
Councillor Keaveney.
Present.
Councillor Boddy.
Present.
Councillor O'Leary.
Present.
Councillor Woodbury.
Present.
Councillor Milne.
Present.
Councillor Soever.
Present.
Councillor Bartnicki.
Present.
Councillor Robinson.
Present.
Councillor Hutchinson.
Present.
There we go. Thank you. Is there any declaration of pecuniary interest? Seeing none, we'll proceed. If one does arise, you'll declare it at the time. Item 5, adoption of the minutes. First, 5A, the County Council and Committee of the Whole minutes of September 26th. Could I get a mover to put that? Councillor Keaveney and Councillor Boddy. Is there any discussion on those minutes? Councillor Soever? Sorry.
There we go. Yes, on the item on the council minutes, CC 1977-19, it refers to council receiving training on the code. I believe the discussion was about a workshop, and training is a little different than a workshop.
Thank you for your indulgence. What we are discussing is whether or not, I suppose, the distinction between training and a workshop is that training can occur in a closed session. It would depend on the wish of council whether they wanted to have certain discussions in closed session or have the entire thing in open session. So one or the other.
Yes, thank you for that distinction, and I guess maybe we could ask council which they prefer. But since the code hasn't been endorsed, how can we be trained on something that hasn't been approved?
Through you, Mr. Warden, really I think we're a little bit into semantics here. The plan, as I understood it from Clerk Heather, was that Principals Integrity would be attending this session, and that we would be spending time going through the proposed changes and updates to the Code of Conduct, as well as reviewing any portions of the code already in force and effect that people had questions or wished to discuss in further detail. My take from some of the conversation around the table was that, you know, some of this is a little bit subjective, and I think the more you can talk through specific examples, the better and clearer and more confident people can be about how the code will be applied. So that was really the purpose of the meeting, was to come out of this with everybody feeling more confident and more educated about exactly what the different aspects of the code were.
So given that discussion, do we leave it the language the way it is, or is there a wish for a change? I don't see anyone putting their hands up to suggest a change, so if not, then I'll call the question on it the way it is written then. Is that okay? So I'll call the question. All those in favor? Are there any opposed? That is carried. Thank you. And item 5B, the Committee of the Whole closed meeting minutes of September 26. I'm looking for a mover. Councillor Milne, seconded. Councillor Patterson. Sorry. Any discussion? Then I'll call the question. All those in favor? Any opposed? Is carried. Thank you. We have no closed meeting matters. Report. Dr. Era is on deck. The Board of Health minutes dated August 23rd, and the Board of Health minutes dated, the report dated September 2019. I'll look for a mover on that. Moved by Councillor O'Leary, seconded by Councillor Patterson. Dr. Era is present. You have the floor.
It's working now. Thank you again for having me. The 3 points that I would see of significance to be mentioned to the board, emphasized, iterated, are 3 of them. The vaping disease, the pulmonary disease resulting from vaping that we hear in the news. The ministry has identified a mechanism for communication of data or collecting of data from the hospitals to the ministry to look closely at the situation. To my dismay, public health has not been part of this mechanism at this point, at least. So the numbers from the states, last time I looked at them October 1st from CDC, around 1,000, a bit over 1,000 disease and around 20 deaths. So if I look at the numbers in Canada, the states would be divided by 10. Their population is 10 times bigger than ours. That would leave us with at least 2 deaths and 100 disease in Canada that we need to discover, and these numbers are only rising. So there is a movement from COMO, the Council of Medical Officers of Health, to actually push for 2 things. The precautionary principle being applied, which means if we don't have concrete evidence on an issue that's affecting health, we need to stop it, then look at the evidence, and that looking at the evidence is the onus of the industry that's causing the harm, if we can call it harm. So these things are moving, and I'll update the board and the council on this going forward. The second item regarding modernization, there has been no announcement as to the appointment of the expert advisor who would be leading the next phase of consultation at this point. And again, I will keep the council posted. The third point, I plan to bring it to the Board of Health in our next session, and I spoke with the Vice Chair if I can bring it to the council just time-wise. It's related to opioid crisis, and it's related to a class action lawsuit that started by the government, the provincial government of British Columbia and Ontario. And there is an appetite for many municipalities, counties or cities to join that class action lawsuit. I know that the Brampton City Council has advised their staff, directed them to look into the costs associated with the opioid crisis, whether it's fire and emergency services, EMS, property damage, staff training, and all these things that were incurred. And the second recommendation to their staff or direction to their staff was to look into the possibility of joining this lawsuit. And after bringing it to the Board of Health, there possibly could be a resolution that would come to the council to advise about the possibility or encourage the county to consider this. If you have any question about these 3 items, please.
Oh.
Thank you, Mr. Warden. The question that I have is, how is the vaping disease, as the doctor referred to it, how is that different from diseases that are caused by tobacco usage? And the reason I ask that question is, we seem to be paying a lot more attention to this disease that's been caused by the use of vaping products than we seem to have paid to, or we've accepted the diseases caused by tobacco, but for some reason we're paying more attention to a disease caused by use of vaping products. So just that was the question I had. Why? How is it different, and why are we paying more attention to it?
Thank you for the question. It really brings an important subject. The first distinction in the severity of injury to the lung tissue. In smoking, usually people smoke for 20, 30 years to get cancer. We're seeing with vaping 1 year of smoking or vaping with an injury that's described by the pathologist who did the autopsy on one of the deceased patients from the Mayo Clinic is very robust report. It described as this has not been seen since the mustard gas was used in the First World War, after 1 year of smoking. So I kind of joined the two distinctions point. The length of injury with smoking, it has been 20, 30 years. Here it's 1 year. And the second one is the severity of injury. There could be a third one, but that's Ian's, my own bias. It is the appetite for the younger generation, the teens, to pick up this habit. Smoking has been established over the past 30, 40 years as a habit that's not appealing to most people, while vaping has become the cool thing to be done. And the numbers went up from around 5%, 6% vaping in teens to around 27 just in 2 years.
Councillor Mackey.
Thank you, Warden. Just wanted to, your comment in regards to the class action lawsuit. Is our Board of Health, are they going to drill down into the merits of whether or not the county should, get on board with that? I think I'd like to have more information come back in regards to that. Certainly, we know there's a lot of costs that we're incurring in regards to the opioid crisis, so it would be interesting to get a little more information. Thank you.
This thing working, it's working. The Board of Health in the Brampton city or in the Niagara region where these two initiatives started is part of the region itself. So it's literally, it would be as if we're part of the county and they're acting as one. So what I see our role is advocacy to put a resolution to the county to consider looking into it. The finances that were incurred by the county are not something that we have the expertise or even the authority to look into. Rather, it will be an internal initiative from the county to look into this. Does this explain that part, or? Sorry, there could be another layer down the road if the county wish. Public health could be an advocacy voice to the public about why the initiative is happening and the cost, real cost to the community health-wise.
So is there a timeline to get on board with this class action suit? Like, when would we expect to have information come back to both this county? It's also a lower tier issue. I mean, the lower tiers, through fire and police are certainly spending dollars. So I just don't want to see it get lost. I'd like to make sure that there is information coming back so that county council can make a determination. Mr. Warden, thank you.
So again, public health would, again, I'm not a lawyer, I cannot speak as a lawyer whether there is a possibility for municipalities to join this action lawsuit. And that's what I have heard about through the channels of communication with different medical officer of health. The recommendation from the Board of Health, I can see it would go as far as, this issue is on the radar, on our radar. We would like it to be on your radar in the county. And the county will take it from there.
Our solicitor has something to add.
If, Dr. Era, if you can be in touch with me, we can put some information together in legal services and bring it back to council if they wish to have a sense of what might be involved.
Certainly.
Okay, I don't see any other questions. So did you have something else, Councillor Mackey?
Need to give direction?
I don't think direction is needed at this stage. I think that we're hearing that there's going to be some conferencing between the health unit and our legal services, and that something will come back. Okay, then I will call the question. All those in favor? Are there any opposed? That's carried. Thank you very much, Dr. Era. We have no bylaws, so we'll move to item 9, good news and celebrations. Do we have any? Councillor Robinson.
Well, thank you very much, Mr. Warden. I would absolutely like to acknowledge that this is Agriculture Week, and I would like to thank our hardworking farmers for all of their work producing, growing, raising the food that we eat, and that also acknowledge their overall contributions to our local communities, but also provincially, nationally and internationally. In addition to that, our Bentic Plowmen's Association held a plow match this past weekend that was most successful. And also, I'd like to acknowledge their celebration of their 80th anniversary this year. Thank you.
Thank you. Councillor Keaveney.
Thank you, Mr. Warden. And I would like to share that for the second year in a row, the municipality of Meaford is hosting part of the Canadian Armed Forces Ardent Defender exercise in partnership with the 4th Canadian Division Training Centre located in Meaford. It's an emergency exercise with other organizations involved, our fire department and police services and so on. The Ardent Defender exercise is a counter-explosive threat training scenario. It's the largest exercise of its kind to take place in Canada. There are participants here from 20 countries all over the world. The aim of the exercise is to refine the skills of defeat threats that could be faced during armed forces operations. And our Mayor, Barb Plumpus, is participating in that exercise today, so it's pretty exciting for the town of Meaford. Thank you.
Thank you. Councillor Burley.
Thank you, Mr. Warden. I have two things. One is Lee Manor is proud to have been awarded the Owen Sound Sun-Times Reader's Choice Award for the best long-term care retirement home in Owen Sound. And congratulations to Renata and her staff. They do a fantastic job. The second one is that I hardly ever talk about it, but the Warden Keppel International Airport. Our passenger service to Toronto is completely sold out again this weekend. We had to put on another flight today. It leaves at 2 o'clock and it's not full yet, so if anybody wants to go to Toronto, it's there. We in Georgian Bus will be looking at it. The service will last as existing now until October 28th. At that time, Council will sit down and revisit the direction that we're going to go for 2020. So it's great for the whole region. I just want to bring you up to date that it's a fantastic facility, and we look forward to everyone to fly to Toronto. Thanks.
Councillor Bartnicki.
Thank you, Mr. Warden. Last weekend in many communities, CIBC Run for the Cure was on, as it was in the town of Blue Mountains, leaving from the village. Over 450 participants, many of them survivors or connected to survivors, were in attendance at that event. They ranged from a very young preteen to a 91-year-old who participated. And a new term was used to educate all of us in attendance, and that was the term previvor. Previvor means a person whose genetic history indicates that they are predisposed with BRCA1 or BRCA2 genes. And I think it's, the reason I'm sharing is on behalf of the previvors. Only 20% of people that carry the gene are ever known. And if you do know, there's health care choices that you can make to prevent or reduce your risk. 80% of people carrying the gene don't get tested and don't have those choices. So it was a very hopeful, very positive event. It's very meaningful to me because I have lost a sister at 41 and my brother last year as well to these cancers. So I'm sure that everybody in the room knows somebody and is touched by it. Please consider the message about previvors and genetic testing for those who have a history. Thank you.
Thank you, Councillor Bartnicki. Councillor Boddy.
Thank you, Warden Hicks. Young woman from Owen Sound named Chris Thompson attended the United States Strong Woman competition, I believe in Texas, and she won it. She's the Pro Women's World 2019 Super Heavyweight and Overall Champion, which is very impressive. And part of the reason why I share that is I know that she's looking for a job somewhere in the area as a volunteer firefighter, and she would probably be strong enough to, none of us would come close. It's quite an achievement. I've watched her work in the gym for the past number of years, and A, she's huge, and B, extremely strong and works extremely hard, and that's quite an achievement. So that's congratulations to Chris.
Councillor Desai.
Thank you, Mr. Warden. Just a short while ago on Dr. Ara's report, we talked about opioids. There is going to be an opioid symposium on October 24th from 5 to 9 p.m. at the Grey Bruce Public Health Unit. It's targeted primarily to physicians, nurse practitioners, and pharmacists. But Councillor Mackey and I were at the Community Drug and Alcohol Strategy meeting yesterday, and they did mention that they would be more than happy, they would appreciate a presence from their political partners at the symposium. I have the email, and the registration needs to happen by October 15th, which is this coming Tuesday. I will send the email off to the Deputy Clerk so that she can fan it out to the rest of Council. Onto a bit more lighter subject. The Rockland Fall Fair occurred on September 28th, and in keeping with tradition of me winning Reserve Grand Champion, I won the pig show. I was showing, of course. Some good old self-deprecating humor. Reserve Grand Champion. It was a great opportunity for anyone who was wanting to do the Warden's Challenge. To be there and participate in an activity. Seeing how I've won 2 Reserve Champion ribbons now, I will be signing autographs. They're $10 a piece or 5 for $30. It's a great deal. It's a huge deal, as someone down south put it. Thank you.
Well, thank you for the news, and especially thank you for the clarification. Councillor Mellon, I would expect you would want to follow that.
Well, thank you, Mr. Warden, and strangely enough, I want to I'll acknowledge, congratulations, and thanks for the clarification. Because we were wondering on this side.
Yeah. I knew it. I thought I'd brighten your day a little.
I want to thank Councillor Robinson for highlighting that this is Ontario Ag Week, and I would invite anyone that's interested. The Grey County Federation of Agriculture is having their annual meeting tomorrow night in Durham at the Legion. There may still be tickets available. If you call the Hanover office, I'm sure Jackie will set you up. If those coming from Wyerton need a place to set down, if they fly down, Hunter's Airstrip is just outside of Durham and Southgate. You might not get stopped before she goes over the edge, but you will be able to set down. So I just wanted to make that known that that's an option for you folks at the north end of the county. If maybe you don't know where the south end of the county is, but I can help you. Talk to me later.
Okay, it looks like we've exhausted the good news. I do want to mention, speaking of the Warden's challenge with respect to tourism, you all have information, I believe, at your desks. It looks like the media has picked up a little bit on the Warden's challenge with respect to tourism, and you have sheets before you extending that challenge out, now called Grey County Tourism Challenge, and lots of good recommendations in there. So we invite the public to explore what's available in Grey County and talk to the world about it. Post on social media about what's going on in our county. All right. I'm looking for a motion to adjourn. Moved by Councillor Woodbury, seconded by Councillor Robinson. All those in favor? Any opposed? That is carried. Thank you. We'll turn our attention next to Committee of the Whole.